the deadlift is a really good exercise to hit the entire posterior chain, which is essentially what we're after when we're doing some of this postural stuff. It's also good because it tethers the hip and the scapula together, and there's a lot of real-world applications to this. This is an exercise that a lot of people are intimidated to do because, yes, you can get hurt if you do this wrong. I've worked in rehab studios with tons of low back patients, and this is an exercise I would gravitate towards. If done really well, it can protect the back. The idea is that we're lifting with the glutes, and the back is going to assist us, not the other way around, which is where I think most people have a problem. So there's a few important things. Our stance, we're going to have about a hip to shoulder width stance, and it's absolutely imperative that we're gripping the floor with our foot all the way down to the big toe, right? And I want you to think of screwing the floor away, or kind of creating a little bit of this rotational torque. Generally, we're going to see a lot of this knee dropping in, so we're going to get ahead of that by just screwing the floor apart. Okay? So from there, we're going to straddle our dumbbell, again, screwing the floor apart, turning our abs on so our pelvis is neutral. Shoulders are pinned, we're going to unlock the knee. Now, take advantage of this position and really tether the scapula back and put some purpose into this position. There's already tension built up here, which is to our benefit. We unlock the knee. Now, my butt is going to go back. As my hips go back, my chest is tipping over. At some point, I'm going to hit hamstring tension, and for me, it's right here. Okay? At this point, I'm going to bend the knee with the idea of continuously driving my hips back. From here, I'm going to come up by bringing my hips up. I squeeze my butt, and I stand up. Okay? Now, there's a lot going on here in this movement. There's a lot of things that can go wrong. So if you're someone who has trouble maintaining this neutral pelvis, you might find that as you hit back, you kick your butt out. I will literally have clients hold their stomachs and just practice just the hip hinge. If at any point you feel yourself kick your butt out, you start over. We unlock, we ab on, my butt goes back, I hit some hamstring tension. When you hit this point of hamstring tension, if you keep going and you just bend over at the spine, that is where we're going to have back problems. The other thing I see a lot of is we bend over at our knees and drop down into a squat. Thinking of a deadlift as simply bending over with a controlled pelvis is the way to go. So here's a good one. Abs are on, shoulders are pinned, a little bit of rotational torque. We've unlocked the knee. My butt is going back, my chest is tipping over. I hit hamstring tension, so I bend the knees so I can continue to push my butt back. I squeeze my glutes, my hips come forward as I stand up. The other issue I tend to see is when we go to stand up, people extend the spine too much. So I'm going to over-exaggerate this, but even just a little deviation from this can have consequences. So I did a good job that I got down here, but if my first action to stand up is to extend the spine and then stand up, I have a problem. So I use the visual of a protractor. If my body was a protractor and my hips are the centerpiece of that protractor, if I pull my hips back, that angle changes. I have two options now to increase the angle of that protractor. I could lift the top of it if somebody grabbed me by my hair. That's the spine that we don't want. Or I bring the centerpiece of the protractor forward to make me stand up. Okay? And that's essentially all a deadlift is. It's bending over with a controlled pelvis. As we hit back, our chest tips over. As we hit hamstring tension, we bend the knees so we can continue to hit back. And then